Sedation. Understanding the use and types of sedation in medical practice. Welcome to our comprehensive guide on sedation in medical procedures. In this video, we'll cover everything you need to know about sedation, its importance, types, indications, benefits, risks, providers, medications, patient evaluation, techniques, monitoring, recovery, post-procedure care, and patient safety. What is sedation? Let's start by defining sedation. Sedation is a medical technique that uses medications to induce a state of relaxation, drowsiness, and reduced awareness in a patient, making them more comfortable during medical procedures. Sedation is a medical technique used to induce a state of relaxation, calmness, and decreased awareness or responsiveness in a patient. Its primary purpose in medical practice is to help patients feel more comfortable, reduce anxiety, alleviate pain, and facilitate various medical procedures or treatments. Sedation is typically administered by trained healthcare professionals and can vary in intensity from mild sedation to deep sedation or general anesthesia, depending on the specific medical context and the patient's needs. Here are some key aspects of sedation. 1. Purpose. Anxiety reduction. Sedation is often used to alleviate a patient's anxiety or fear, making them more relaxed and cooperative during medical procedures. Pain management. Sedatives can be used in conjunction with pain relief techniques to reduce discomfort and pain. Facilitation of procedures. Sedation helps in performing procedures that may be uncomfortable, painful, or require the patient to remain still for an extended period. 2. Levels of sedation. Minimal sedation. The patient is relaxed but fully conscious and able to respond to stimuli and questions. Moderate sedation, also known as conscious sedation, the patient is in a deeper state of relaxation but can still respond to verbal commands. Deep sedation, the patient is nearly unconscious and may not respond to verbal commands but can be awakened with more substantial stimulation. General anesthesia, the patient is completely unconscious and typically requires artificial ventilation to maintain oxygen levels and airway control. 3. Administration. Sedation can be administered through various methods, including oral medications, intravenous, 4. Injections, inhalation of gases, example nitrous oxide, or even intramuscular injections, depending on the procedure and patient's condition. 4. Monitoring. Continuous monitoring of vital signs such as heart rate, blood pressure, oxygen saturation, and respiratory rate is crucial when administering sedation to ensure the patient's safety and well-being. 5. Recovery. After the procedure, patients are typically monitored in a recovery area until they regain full consciousness and are stable enough to be discharged or transferred to another care unit. Sedation is commonly used in various medical settings, including dentistry, surgery, endoscopy, and radiology. It allows healthcare providers to perform necessary treatments or examinations with reduced patient discomfort and anxiety while maintaining patient safety. The choice of sedation level and technique depends on the specific medical procedure, the patient's medical history, and individual preferences. Importance of sedation in medical procedures. Sedation plays a crucial role in medical procedures for both patients and healthcare providers. It helps manage pain and anxiety, making procedures more tolerable, efficient, and safe. Sedation plays a crucial role in various medical procedures, as it offers several important benefits for both patients and healthcare providers. Here are some key aspects highlighting the importance of sedation in medical procedures. 1. Patient comfort and relaxation. Sedation helps patients relax and feel more comfortable during invasive or uncomfortable medical procedures. This is especially valuable for procedures that may cause pain, anxiety, or distress. 2. Pain management. Sedation can effectively reduce pain perception during procedures. Depending on the level of sedation, it can range from mild pain relief to complete insensitivity to pain, allowing for complex or lengthy procedures to be performed without causing undue discomfort. 3. Anxiety and stress reduction. Many patients experience anxiety and stress when facing medical procedures, particularly those involving surgery or diagnostic tests. Sedation helps alleviate these psychological distresses, making the overall experience less traumatic. 4. Improved procedure quality. When patients are relaxed and not in pain, medical professionals can perform procedures more accurately and with better precision. This can lead to improved outcomes and reduced risks of complications. 5. Enhanced patient cooperation. Some procedures require patient cooperation, such as staying still during imaging or maintaining a specific position during surgery. Sedation can help patients comply with these requirements, making the procedure more efficient and successful. 6. Increased safety. By reducing patient anxiety and discomfort, sedation can contribute to a safer medical environment. Patients are less likely to move suddenly or experience stress-related complications, which can improve the overall safety of the procedure. 7. Time and resource efficiency. Sedation can lead to quicker procedures, as it often allows healthcare providers to work more efficiently without interruptions caused by patient discomfort or anxiety. This can result in shorter procedure times and better resource allocation. 8. Patient satisfaction. When patients have a positive experience during a medical procedure, it can lead to higher patient satisfaction and improved compliance with follow-up care or future medical interventions. 9. Pediatric and geriatric care. Sedation is particularly valuable for children and elderly patients who may struggle with understanding or tolerating certain medical procedures. It can make the process less frightening and more manageable for these vulnerable populations. 10. Versatility. Sedation can be tailored to the specific needs of the patient and procedure. Healthcare providers can choose from various levels of sedation, ranging from minimal, conscious sedation, to deep sedation or general anesthesia, depending on the circumstances. While sedation offers numerous benefits, it should be administered by trained healthcare professionals who consider the patient's medical history, individual needs, and potential risks. The type and level of sedation used must be carefully determined to ensure patient safety and the successful completion of the medical procedure. Types of sedation. There are different types of sedation, ranging from mild to deep, including conscious sedation, deep sedation, and general anesthesia. We'll delve into each type and their specific applications. Sedation is a medical practice used to induce a state of relaxation and reduced awareness in a patient for various medical procedures, such as surgeries, dental work, or diagnostic tests. There are different levels of sedation, each with its own characteristics and applications. Here are the various types of sedation, along with their key differences. 1. Minimal sedation, anxiolysis. Also known as anxiolysis, minimal sedation aims to reduce anxiety and promote relaxation in the patient while allowing them to remain fully awake and alert. Patients under minimal sedation can respond to verbal cues and physical stimulation. It is commonly used for procedures that cause mild anxiety, such as dental cleanings or minor skin surgeries. 2. Moderate sedation, conscious sedation. Moderate sedation, often referred to as conscious sedation, induces a state of deep relaxation and drowsiness in the patient. Patients can respond to verbal commands but may not remember the procedure afterward. It is used for more invasive procedures like colonoscopies, endoscopies, and some dental procedures. 3. Deep sedation. Deep sedation involves a more profound level of sedation, bordering on unconsciousness. Patients are on the verge of unconsciousness but can be awakened with more vigorous stimulation. Deep sedation is typically used for complex surgeries or procedures where the patient needs to be very still and unaware of the procedure. 4. General anesthesia. General anesthesia is the deepest level of sedation, rendering the patient completely unconscious and unresponsive to pain or external stimuli. It involves the administration of anesthetic drugs that induce a controlled loss of consciousness. It is used for major surgeries, such as heart surgery, brain surgery, or complex orthopedic procedures. Patients require artificial ventilation during general anesthesia. Key differences. The primary difference between these types of sedation is the depth of sedation and the patient's level of consciousness. Minimal sedation keeps the patient fully awake and alert, while moderate sedation induces drowsiness but maintains consciousness. Deep sedation borders on unconsciousness, and patients can be awakened with more significant stimulation. General anesthesia renders the patient completely unconscious and unresponsive to pain. The choice of sedation type depends on the nature of the procedure, the patient's medical condition, and their level of anxiety or pain tolerance. It is essential for healthcare providers to carefully assess each patient's needs and risks and select the appropriate level of sedation to ensure their safety and comfort during medical procedures. The monitoring and administration of sedation should be carried out by trained professionals to minimize complications and ensure patient well-being. Indications for sedation. Discover when sedation is indicated in medical procedures. We'll explore the conditions and situations where sedation is beneficial for patient comfort and procedural success. Sedation is a medical technique used to induce a state of calmness, relaxation, and decreased awareness in patients for various purposes. It is typically employed in medical procedures to alleviate anxiety, pain, and discomfort while allowing the procedure to be performed safely and effectively. Here are some indications for sedation and examples of medical scenarios where it is beneficial. 1. Minimizing anxiety and fear. Sedation can help reduce anxiety and fear associated with medical procedures. For example, dental procedures. Patients may receive sedation for tooth extractions, root canals, or dental surgeries to alleviate dental anxiety. MRI or CT scans. Sedation can be used for patients with claustrophobia or extreme anxiety during these imaging tests. 2. Pain management. Sedation can be combined with local anesthesia or other pain management techniques to enhance patient comfort during painful procedures. Examples include endoscopy. Sedation is often used during procedures such as colonoscopies or upper endoscopies to minimize discomfort. Orthopedic procedures. Sedation can be administered during setting fractures, joint injections, or other orthopedic treatments. 3. Enhancing procedure tolerance. Some medical procedures can be lengthy, uncomfortable, or require patients to remain still. Sedation helps patients tolerate such procedures. Cardiac catheterization. Patients may receive sedation to remain still and relaxed during this diagnostic procedure. Radiation therapy. Sedation can be used for patients undergoing radiation therapy who need to lie still for extended periods. 4. Facilitating pediatric procedures. Sedation is commonly used in pediatric medicine to help children stay calm and still during procedures. Pediatric surgery. Sedation is administered to children before surgery to minimize distress and ensure a successful procedure. Diagnostic tests. Sedation can be employed during tests like MRIs, CT scans, or echocardiograms for pediatric patients. 5. Reducing muscle spasms. Sedation can be used to relax muscles, making it easier to perform certain medical interventions. Intubation and mechanical ventilation. Patients may receive sedation to facilitate the insertion of a breathing tube and mechanical ventilation in the intensive care unit. Reduction of dislocations. Sedation can be employed before reducing a dislocated joint to minimize pain and muscle tension. 6. Seizure management. In cases of prolonged or severe seizures, sedation may be used to stop the seizure activity and protect the patient from harm. 7. Psychiatric and behavioral management. Sedation can be utilized in psychiatric and behavioral health settings to manage severe agitation, aggression, or psychosis when other interventions are ineffective or when patient safety is at risk. It's important to note that the choice to use sedation should be made carefully, considering factors such as the patient's medical history, age, the nature of the procedure, and potential risks associated with sedative medications. The goal of sedation is to provide comfort and safety for patients during medical procedures, and it should always be administered by trained healthcare professionals who can monitor the patient's condition throughout the procedure. Benefits of sedation. Sedation offers numerous benefits, such as pain relief, reduced anxiety, improved patient cooperation, and enhanced procedural outcomes. We'll explore these advantages in detail. Sedation is a medical practice used in various healthcare settings to provide several benefits to patients and healthcare providers. Here are some of the advantages of using sedation. 1. Pain management. Sedation can significantly reduce or eliminate the perception of pain during medical procedures. It is particularly useful for invasive or painful procedures, such as surgeries, dental work, and minor interventions. By minimizing pain, sedation helps improve patient comfort and tolerance during and after the procedure. 2. Anxiety reduction. Many patients experience anxiety and fear before undergoing medical procedures or treatments. Sedation helps alleviate anxiety and induces a state of relaxation and calmness. This not only improves the patient's overall experience but also helps reduce stress-related complications. 3. Improved patient cooperation. Sedation can make patients more cooperative and compliant during medical procedures. Patients who are nervous, agitated, or uncooperative can be challenging to work with, and sedation helps ensure that they remain still and relaxed, allowing healthcare providers to perform the procedure safely and effectively. 4. Enhanced procedure success. Sedation can improve the overall success rate of medical procedures. When patients are relaxed and pain-free, healthcare providers can perform their tasks more precisely and efficiently. This can lead to fewer complications, shorter procedure times, and better outcomes. 5. Reduced trauma and complications. Sedation can reduce the physical and emotional trauma associated with medical procedures. It can minimize the risk of injury due to patient movement or reflex actions. Additionally, by keeping patients calm and comfortable, sedation may reduce the likelihood of complications or adverse reactions during or after the procedure. 6. Quicker recovery. Sedation can facilitate a smoother and quicker recovery process. When patients are not in pain or distress during and after the procedure, they are more likely to recover faster and experience fewer post-procedure complications. 7. Enhanced patient experience. Sedation can enhance the overall patient experience by making medical procedures less intimidating and uncomfortable. This can lead to increased patient satisfaction and improved patient-doctor relationships. 8. Increased safety. In some cases, sedation can enhance the safety of certain medical procedures by ensuring that patients remain still and cooperative. This is particularly important for procedures that require precision and accuracy. 9. Reduced memory of the procedure. Sedation can induce temporary amnesia or partial memory loss of the procedure, which can be beneficial for patients who may find the procedure distressing or anxiety-provoking. This can help reduce the psychological impact of the procedure. 10. Applicability to various settings. Sedation can be used in a wide range of healthcare settings, including hospitals, dental offices, outpatient clinics, and emergency rooms, making it a versatile tool for managing pain and anxiety in various medical scenarios. It's important to note that the type and level of sedation used should be carefully determined by healthcare professionals based on the patient's individual needs, medical history, and the nature of the procedure to ensure its safety and effectiveness. Risks and complications. While sedation is generally safe, there are risks and potential complications to be aware of. We'll discuss these, including allergic reactions, respiratory issues, and more. Sedation is a medical procedure commonly used to relax or calm patients during various medical and dental procedures. While sedation can be highly beneficial in managing patient anxiety and discomfort, it is not without risks and potential complications. It is crucial to understand these risks and emphasize the importance of proper patient assessment and monitoring to ensure the safety and well-being of the patient. Here are some key points to consider. 1. Respiratory depression. One of the most significant risks associated with sedation is respiratory depression, where a patient's breathing becomes slow or shallow. This can lead to decreased oxygen levels in the blood, potentially causing hypoxia or even respiratory arrest. Proper monitoring of respiratory rate and oxygen saturation is essential to detect and address this complication promptly. 2. Cardiovascular complications. Sedation can affect heart rate and blood pressure. Patients with underlying cardiovascular conditions may be at greater risk of complications such as arrhythmias or changes in blood pressure. Close monitoring of vital signs is crucial, especially in patients with pre-existing heart issues. 3. Allergic reactions, although rare. Some patients may have allergic reactions to the medications used for sedation, including anesthesia drugs. Proper patient assessment should include a review of allergies to medications and a detailed medical history. 4. Nausea and vomiting. Some patients may experience nausea and vomiting as a result of the sedation medications. This can be uncomfortable for the patient and, in extreme cases, lead to aspiration pneumonia. Antiemetic medications can help mitigate this risk, and proper patient positioning can reduce the chances of aspiration. 5. Delayed recovery. Not all patients recover from sedation at the same rate. Some may experience prolonged drowsiness or disorientation after the procedure, which can impair their ability to function normally. Patients should be closely monitored until they are fully awake and alert. 6. Infection. If the sedation involves the use of intravenous lines or other invasive procedures, there is a risk of infection. Proper sterile technique and infection control measures must be followed to minimize this risk. 7. Inadequate sedation. In some cases, the sedation may be insufficient, leading to patient discomfort or anxiety during the procedure. Conversely, excessive sedation can result in deeper levels of unconsciousness than intended, potentially leading to complications such as difficulty in awakening or prolonged recovery times. 8. Psychological effects. Sedation can sometimes result in psychological reactions such as agitation, confusion, or hallucinations. It is essential to explain these potential side effects to the patient and address any concerns they may have. Importance of proper patient assessment and monitoring. 1. Patient selection. Careful patient selection is essential. A thorough medical history, including allergies, current medications, and any underlying medical conditions, should be obtained to determine if sedation is appropriate. 2. Informed consent. Patients must be informed about the risks and benefits of sedation and provide informed consent before the procedure. 3. Qualified personnel. Sedation should be administered and monitored by qualified healthcare professionals who are trained in sedation techniques and emergency response. 4. Continuous monitoring. Patients under sedation should be continuously monitored for vital signs, including heart rate, blood pressure, respiratory rate, and oxygen saturation. Monitoring equipment should be in place and functioning correctly throughout the procedure. 5. Emergency preparedness. Healthcare providers should be prepared to respond to any complications promptly. This includes having emergency medications and equipment readily available and knowing how to manage adverse events effectively. While sedation can be a valuable tool in managing patient discomfort and anxiety during medical procedures, it is not without risks and potential complications. Proper patient assessment, informed consent, and vigilant monitoring by qualified healthcare professionals are crucial to minimize these risks and ensure patient safety. Sedation providers. Learn about the healthcare professionals who administer sedation, including anesthesiologists, nurse anesthetists, and other specialized providers. Healthcare professionals qualified to administer sedation include: 1. Anesthesiologists. Anesthesiologists are medical doctors who specialize in the field of anesthesia and perioperative care. They are highly trained in administering various levels of sedation and anesthesia, including general anesthesia, regional anesthesia, and conscious sedation. Anesthesiologists play a crucial role in ensuring patient safety during surgery and other medical procedures by carefully monitoring the patient's vital signs and adjusting the sedation as needed. 2. Nurse anesthetists. Nurse anesthetists, also known as Certified Registered Nurse Anesthetists, CRNAs, are advanced practice nurses with specialized training in anesthesia. They work collaboratively with anesthesiologists, surgeons, and other healthcare providers to administer anesthesia and sedation. CRNAs are skilled in evaluating patients, selecting appropriate anesthesia techniques, and managing anesthesia throughout the surgical or procedural process. 3. Dentists. Dentists are qualified to administer sedation in dental procedures, especially for patients who experience dental anxiety or require more extensive treatments. They may use various levels of sedation, including nitrous oxide, laughing gas, oral sedatives, or intravenous, for sedation, depending on the patient's needs and the complexity of the dental procedure. Dentists who provide sedation are typically required to undergo additional training and certification in sedation dentistry. 4. Physicians. Physicians from various specialties, such as surgeons, gastroenterologists, and interventional radiologists, may also administer sedation when performing procedures that require patient comfort and relaxation. These physicians typically receive training in sedation techniques relevant to their field and may work alongside anesthesiologists or nurse anesthetists to ensure patient safety. It's essential for all healthcare professionals who administer sedation to have the appropriate training, certification, and experience to manage sedated patients safely. The level of sedation administered should align with the patient's medical condition, the nature of the procedure, and the provider's expertise, with a primary focus on patient well-being and minimizing the risk of complications. Sedation medications. Explore the medications used for sedation, their mechanisms of action, and how they are chosen based on the procedure and patient's needs. Sedation medications are drugs used to induce a state of relaxation, drowsiness, or sleepiness in patients for various medical procedures or in specific clinical situations. These medications can be administered through various routes, depending on the patient's needs and the procedure being performed. Here's an overview of some common sedation medications and their modes of administration. 1. Oral sedatives. Benzodiazepines, medications like diazepam, Valium, lorazepam, Ativan, or midazolam, Versed, can be taken orally in pill or liquid form. They are commonly used for preoperative anxiety and sedation. Barbiturates, less commonly used today due to their potential for overdose and addiction. Examples include phenobarbital and secobarbital. 2. Intravenous, 4. Sedatives. Propofol, administered through an 4-line. Propofol is a potent sedative and general anesthetic used for procedures like colonoscopies or surgery. Midazolam, often used in combination with opioids for moderate sedation during procedures like endoscopies. Administered through an 4-line. 3. Inhalation sedatives. Nitrous oxide, also known as laughing gas. Nitrous oxide is inhaled through a mask and is commonly used for dental procedures and minor surgeries. Sevoflurane and desflurane, these are volatile anesthetic agents inhaled through specialized equipment for general anesthesia during surgery. 4. Intramuscular, IM, sedatives. Ketamine. Ketamine can be administered through an intramuscular injection. It induces dissociative anesthesia and is sometimes used in emergency situations or for pediatric sedation. Droperidol, an antipsychotic medication occasionally used for sedation in emergency settings. 5. Transdermal sedatives. Scopolamine. Transdermal patches containing scopolamine are sometimes used for motion sickness or as a preoperative medication. The drug is absorbed through the skin. 6. Rectal sedatives. Diazepam or midazolam. In some cases, these benzodiazepines can be administered rectally, especially in pediatric or uncooperative patients. 7. Oral inhalation sedatives. Chloral hydrate. Administered orally in liquid form, chloral hydrate is sometimes used for pediatric sedation, particularly for diagnostic procedures. It's crucial to note that the choice of sedation medication and its mode of administration depends on factors such as the patient's medical condition, the type of procedure, the patient's age, and their anxiety level. Additionally, healthcare providers must carefully monitor patients during sedation to ensure their safety and well-being, as excessive sedation can lead to complications, including respiratory depression or cardiovascular issues. The appropriate medication and route of administration should always be determined by a qualified medical professional. Patient evaluation. Before administering sedation, a thorough patient evaluation is essential. We'll discuss the evaluation process, including medical history, allergies, and physical assessments. Pre-sedation patient assessment is a critical component of safe and effective sedation practices in medical and dental procedures. It involves evaluating a patient's medical history, physical condition, and other relevant factors to determine their suitability for sedation and to minimize potential risks. Here, we'll highlight the importance of pre-sedation patient assessment and discuss the assessment criteria and considerations. Importance of pre-sedation patient assessment. 1. Safety. Patient safety is paramount during sedation procedures. An in-depth assessment helps identify potential risks and contraindications, ensuring that sedation is administered only to patients who can tolerate it safely. 2. Optimal sedation selection. Based on the assessment findings, healthcare providers can select the most appropriate type and level of sedation for the individual patient, whether it's minimal sedation, moderate sedation, deep sedation, or general anesthesia. 3. Customized care. Each patient is unique, and their response to sedation drugs can vary widely. A thorough assessment allows healthcare providers to tailor sedation plans to the patient's specific needs and preferences. 4. Patient comfort. Pre-sedation assessment also involves addressing patient concerns, answering questions, and alleviating anxiety. This can enhance patient comfort and cooperation during the procedure. Assessment criteria and considerations. 1. Medical history. Review the patient's complete medical history, including chronic illnesses, previous surgeries, and medications, prescription and over-the-counter. Pay attention to allergies, especially to medications or anesthesia agents. Ask about any history of adverse reactions or complications during previous sedation or anesthesia experiences. 2. Physical examination. Perform a physical examination to assess the patient's current health status. Evaluate vital signs, blood pressure, heart rate, respiratory rate, temperature, to detect any abnormalities. Assess the patient's airway, breathing, and circulation, ABCs, to ensure they are stable. 3. Psychological and behavioral assessment. Gauge the patient's anxiety levels, understanding of the procedure, and ability to cooperate. Assess any mental health conditions that might affect their response to sedation. 4. NPO status. Determine the patient's fasting status, NPO, nil per os, to prevent aspiration during the procedure. Follow established guidelines for fasting times based on the type of procedure and age of the patient. 5. Informed consent. Ensure the patient understands the sedation process, risks, benefits, and alternatives. Obtain informed consent, addressing any questions or concerns. 6. Monitoring equipment. Prepare necessary monitoring equipment, such as pulse oximetry, ECG, blood pressure cuffs, and capnography, to continuously monitor the patient during the procedure. 7. Emergency preparedness. Have an emergency plan in place and the appropriate equipment and personnel to respond to potential complications or adverse events during sedation. 8. Post-sedation care. Discuss post-sedation care instructions, including restrictions on activities, driving, and eating/drinking, with the patient and their caregivers. 9. Documentation. Thoroughly document the pre-sedation assessment, including all findings, discussions, and informed consent. In conclusion, pre-sedation patient assessment is a crucial step in ensuring the safety and success of sedation procedures. Healthcare providers must diligently evaluate each patient's medical history, physical condition, and psychological factors to make informed decisions about sedation and minimize the risk of complications. This comprehensive approach not only enhances patient safety but also contributes to a positive patient experience. Sedation techniques. Discover various techniques for administering sedation, such as intravenous, sedation, inhalation sedation, and oral sedation. Each method has its unique advantages. Here are common techniques for administering sedation in a dental or medical setting, along with their pros and cons. 1. Inhalation sedation, nitrous oxide. Pros. Rapid onset and offset. Nitrous oxide is quickly absorbed and eliminated from the body, allowing for precise control of sedation levels during the procedure. Minimal recovery time. patients can often resume normal activities immediately after the procedure. Good safety record. Nitrous oxide has a long history of safe use in dental and medical settings. Can be used for mild to moderate sedation. Cons. Limited depth of sedation. Nitrous oxide may not be sufficient for patients who require deep sedation or general anesthesia. Limited effectiveness for extremely anxious or phobic patients. Some patients may experience side effects like nausea, vomiting, or dizziness. 2. Intravenous, for sedation. Pros. Rapid onset and adjustable depth, for sedation allows for precise control over the level of sedation, making it suitable for a wide range of procedures and patient needs. High effectiveness, it can provide deep sedation or even general anesthesia when necessary. Rapid recovery, the effects of sedation wear off relatively quickly once the administration is stopped. Continuous monitoring, patients can be closely monitored throughout the procedure. Cons. Requires specialized training. Administering sedation requires advanced training and certification, typically from an anesthesiologist or a specially trained dentist. Potential for complications. While generally safe when administered by a trained professional, there are potential risks associated with sedation, including allergic reactions and respiratory depression. Limited patient control. Patients have no control over the sedation level, which can be a drawback for some. 3. Oral sedation. Pros. Ease of administration. Oral sedation involves taking a pill or liquid medication, making it non-invasive. Suitable for moderate sedation, it can provide a moderate level of sedation for patients with mild to moderate anxiety. Minimal equipment required. Unlike sedation, it does not require specialized equipment. Cons. Slower onset and offset. Oral sedatives take time to be absorbed and metabolized, which can make it challenging to achieve precise sedation levels. Limited effectiveness for extreme anxiety. It may not be sufficient for extremely anxious or phobic patients. Potential for excessive sedation. There's a risk of oversedation if the dosage is not carefully monitored. Each sedation technique has its own set of advantages and limitations, and the choice of technique depends on factors such as the patient's medical history, the type of procedure, the patient's anxiety level, and the expertise of the healthcare provider. A thorough assessment and consultation with a qualified healthcare provider are essential to determine the most appropriate sedation method for each individual case. Additionally, strict safety protocols and monitoring should be in place regardless of the chosen sedation technique to ensure patient safety during the procedures. Monitoring during sedation. We'll delve into the critical role of monitoring patients during sedation, including vital signs, oxygen levels, and responsiveness, to ensure their safety throughout the procedure. Monitoring during sedation is crucial to ensure the safety and well-being of a patient. When a patient is undergoing sedation, whether for a medical procedure or dental work, several essential parameters must be continuously monitored to detect any potential complications or adverse reactions promptly. Here are the key parameters to monitor during sedation. 1. Heart rate, HR. Heart rate measures the number of heartbeats per minute and is a vital parameter to monitor during sedation. It helps assess the patient's cardiovascular status and can detect signs of bradycardia, slow heart rate, or tachycardia, fast heart rate. Significant deviations from the baseline heart rate can indicate a potential issue or the need for adjustment in sedative medications. 2. Blood pressure, BP, Blood pressure measures the force of blood against the walls of the arteries and is another critical parameter to monitor. Monitoring BP can identify hypertension, high blood pressure, or hypotension, low blood pressure, that might result from the sedation process or the patient's underlying condition. Fluctuations in blood pressure can have a significant impact on a patient's well-being, and prompt intervention may be necessary if BP deviates from the normal range. 3. Oxygen saturation, SpO2. Oxygen saturation measures the percentage of oxygen bound to hemoglobin in the blood and is a crucial parameter for assessing a patient's respiratory function. A SpO2 reading below the acceptable range, typically 95 to 100%, may indicate hypoxemia, low oxygen levels, which can result from respiratory depression or airway obstruction. Maintaining adequate oxygen saturation is essential to prevent oxygen deprivation during sedation. 4. Respiratory rate, RR. Respiratory rate refers to the number of breaths a patient takes per minute and is a key indicator of the adequacy of ventilation. Monitoring RR helps detect any signs of respiratory depression, which is a common concern during sedation. Abnormal respiratory rates, such as slow or irregular breathing, can signify a problem that requires immediate attention. In addition to these primary parameters, healthcare providers should also consider monitoring other vital signs and clinical signs, such as level of consciousness, skin color, and capnography, end-tidal carbon dioxide levels. The choice of monitoring parameters may vary depending on the type and depth of sedation, the patient's medical history, and the specific procedure being performed. Continuous monitoring and close observation by trained healthcare professionals are essential to detect and respond to any adverse events promptly. Proper monitoring protocols and equipment, such as electrocardiogram, ECG, monitors, non-invasive blood pressure cuffs, pulse oximeters, and capnography devices, should be in place to ensure the safety of patients undergoing sedation. Recovery and post-procedure care. After the procedure, proper recovery and post-procedure care are essential. We'll discuss what patients can expect and the steps taken to ensure their well-being. Post-sedation recovery and post-procedure care are essential aspects of ensuring the well-being and safety of patients who have undergone medical procedures involving sedation or anesthesia. Here's an overview of the post-sedation recovery process and the importance of monitoring patients after the procedure. 1. Post-sedation recovery process. After a medical procedure involving sedation or anesthesia, patients need a period of recovery to safely regain consciousness, motor skills, and alertness. The specific process may vary depending on the type of sedation used, the complexity of the procedure, and the patient's individual response. Here are some key elements of the post-sedation recovery process. A. Observation. Patients are closely monitored in a designated recovery area by trained medical personnel. Vital signs such as heart rate, blood pressure, respiratory rate, and oxygen saturation are continually monitored. B. Airway management. Ensuring the patient's airway is clear and that they can breathe comfortably is a top priority. Sometimes, patients may need supplemental oxygen or assisted ventilation during this phase. C. Pain management. Pain control is essential, especially if the procedure was invasive or painful. Medications, such as opioids or non-opioid pain relievers, may be administered as needed. D. Nausea and vomiting. Some patients may experience nausea and vomiting as a side effect of anesthesia. Antiemetic medications can be provided to alleviate these symptoms. E. Recovery duration. The duration of the recovery period can vary but typically lasts until the patient is fully awake, alert, and stable. This may take a few hours in some cases. F. Patient education. Once the patient is coherent, they should be provided with information about their procedure, any potential side effects, and post-operative instructions. 2. Importance of monitoring patients after the procedure. Monitoring patients after a procedure involving sedation or anesthesia is crucial for several reasons. A. Safety. Anesthesia can affect different individuals in various ways, and complications can arise. Continuous monitoring allows healthcare providers to promptly identify and address any issues, ensuring the patient's safety. B. Early detection of complications. Monitoring vital signs and the patient's overall condition can help detect complications like respiratory distress, allergic reactions, or cardiac problems early on. Timely intervention can prevent these issues from becoming life-threatening. C. Pain management. Post-surgical pain can be distressing. By monitoring the patient, healthcare providers can assess pain levels and adjust pain management strategies as needed, improving patient comfort. D. Preventing aspiration. Patients may be at risk of aspirating stomach contents if they vomit during recovery. Monitoring helps in identifying this risk and taking appropriate precautions. Reassurance and support. Patients may feel disoriented or anxious after sedation. Continuous monitoring provides reassurance and allows for prompt support for any psychological or emotional distress. In summary, the post-sedation recovery process and the ongoing monitoring of patients after a procedure are integral to ensuring their well-being, minimizing complications, and providing the necessary support during the critical immediate aftermath of medical interventions involving sedation or anesthesia. Patient safety and comfort are the primary goals during this phase of care. Patient safety. Patient safety is paramount during sedation. We'll outline safety protocols, emergency preparedness, and how healthcare providers prioritize the well-being of their patients. Patient safety is of paramount importance when administering sedation in a healthcare setting. Whether it's for a medical procedure, dental work, or any other situation where sedation is required, healthcare professionals must prioritize patient safety at all times. Here are some key points to emphasize and discuss when it comes to patient safety during sedation. 1. Pre-sedation assessment. Thoroughly assess the patient's medical history, allergies, current medications, and any pre-existing conditions that may affect the choice of sedation and the patient's response to it. Evaluate the patient's physical status and suitability for sedation using appropriate classification systems, example, ASA Physical Status Classification. 2. Informed consent. Ensure that the patient or their legal guardian provides informed consent, which should include information about the risks and benefits of sedation and alternatives. 3. Monitoring. Implement continuous monitoring of vital signs, example, heart rate, blood pressure, oxygen saturation, throughout the sedation procedure. Use appropriate monitoring equipment and ensure that it is functioning correctly. 4. Qualified personnel. Only allow trained and qualified healthcare professionals to administer sedation. Maintain competency through ongoing education and training. 5. Choice of sedation. Select the appropriate type and level of sedation based on the procedure, patient's age, medical condition, and their level of anxiety or discomfort. 6. Emergency preparedness. Develop and regularly review emergency protocols specific to sedation, including the identification and management of potential complications. Ensure all healthcare providers involved in the procedure are familiar with these protocols. Have necessary emergency equipment readily available and regularly check its functionality, example, defibrillator. Emergency medications. 7. Patient monitoring during sedation. Continuously assess the patient's level of sedation and response to stimuli. Be prepared to adjust the level of sedation as needed. 8. Documentation. Maintain accurate and complete records of the sedation procedure, including vital signs, medications administered, and any complications or adverse events. 9. Post-sedation care. Continue monitoring the patient's vital signs and level of consciousness during recovery. Have a designated area for post-sedation recovery with trained personnel to provide care and support. 10. Communication. Ensure clear and effective communication among the healthcare team members during the entire procedure. Establish a system for conveying important information quickly in case of emergencies. 11. Patient education. Provide patients with clear instructions for pre-sedation and post-sedation care. Educate them on what to expect during the procedure and recovery. 12. Follow-up. Schedule appropriate follow-up appointments to monitor the patient's recovery and address any post-sedation issues. 13. Quality improvement. Continuously evaluate and improve sedation practices through regular reviews, incident reporting, and learning from adverse events. By emphasizing these principles and discussing emergency protocols, healthcare providers can create a safer environment for patients undergoing sedation, minimize risks, and ensure a prompt response to any complications that may arise during the procedure. Regular training and updates are essential to maintaining a high standard of patient safety during sedation.